Good evening. I'm going to leave you with 3 take-home messages. The first is that organ replacement therapy, or transplantation as you know it, is going to undergo a radical and disruptive change. The second, I'll introduce you to the concept of personalized medicine or precision medicine for the organ. You heard about that concept. And finally, that the future will involve organ restoration centers, where we will build super organs that will be designed to outlive the recipient that we put them in. My name is Shaf Keshavjee. I'm the director of the Toronto Lung Transplant Program, and I'm Surgeon-in-Chief at University Health Network in Toronto. And I am going to talk to you a little bit about lung transplantation. The first successful lung transplant in the world was actually done at Toronto General Hospital, and we have continued to be the leading innovators in the field of lung transplantation. I was just going to say to Kevin, we're nice plus. We do lead the world in lung transplantation, hands down. The problem is there are not enough organs available. Even of the ones available to us, only 15% of donor lungs can be used. And some of the organs we get aren't quite up to the task. Your lungs were not designed to be taken out of your body, flown across the country, and put into someone else. They weren't expecting that. So sometimes we can modify that. The other thing is these lungs, even though we do our best, sometimes they fail, either early or late. Transplantation was made possible by cold flush preservation. You flush the organ with a cold solution, cool down the temperature, and basically you slow down the dying process and race the clock to get that organ back into the recipient and have blood flow and nutrition restored to it as soon as possible. Now, you heard the concept of personalized medicine or precision medicine, and that's applied to patients. Every tumor is different. The cause of blood pressure is different in different people, of blood pressure elevation, and likewise, every patient is different. Similarly with organs, but we've never had the opportunity to apply concepts of precision medicine to organs when we're racing the clock in the middle of the night. We've now created the technology in Toronto that provides the opportunity for personalized medicine for the organ. We've developed a technique called ex vivo lung perfusion, where you take the lungs out of the body, put them on a machine at normal body temperature. They're breathing and perfused and supplied with nutrition and oxygen, and they can be kept alive where we maintain them. We can diagnose what's wrong with them. We can treat them and make sure that they're okay before we implant them. And more importantly, as I said, we can prepare them for the task that's coming, that they are going to be transplanted. They're going to be exposed to an immune system that's going to see them as foreign and try and destroy them. And we can improve their likelihood of being successful at this. More importantly, instead of transplanting an organ with our best available knowledge of it, we can actually test its function and transplant a known product with a predictable outcome, with a better long-term outcome as well. And this is actually quite mind-blowing when you think about that concept. It's not science fiction. We're doing it every day. We've done this over 200 times in our hospital, and I know that there are people that live in Halifax that have received ex vivo lung perfusion because of the improvement in this technology. It's very challenging to think of how do we now scale this up to make this available across the country and across the world. Who will do this added work? Where will it be done? Who will pay for it? The current status is the donor is in a hospital somewhere. Multiple centers are contacted that have patients on waiting lists for different organs. And we send 5 or 6 planes in the middle of the night with 5 or 6 teams of surgeons to retrieve organs. The organs are retrieved and then transported back to the various transplant centers. The payers pay the donor hospitals, they pay the transport companies for the planes, the time, they pay the coordinators, the recipient hospital staff, and so on. It's highly inefficient, but it is how it naturally evolved in transplantation, and it's the way we do it today. In fact, For this to realize and improve the number of lives we can save and the number of organs we can transplant with better outcomes, the whole transplant ecosystem will have to change. So consider the concept, the last one that I'll cover, of having organ repair centers. This is not far-fetched. It's very similar to what happened in the evolution of blood transfusion. The first time somebody thought of transfusing blood was a soldier bleeding in a battlefield, and they took blood directly from the healthy soldier and transfused the injured soldier to save their life. The next step was to develop blood transfusion labs and clinics in each hospital. But nowadays, we don't go all over the place to collect blood and process it and transfuse it. Blood is collected in a reliable, standardized fashion at blood transfusion collection centers. The blood is processed. It's separated into its component parts, red cells, plasma, platelets, clotting factors, so that it's prepared so that each patient gets what they need. If you need red cells, you don't need the platelets. If you need platelets, you don't need the red cells. It becomes efficient. It uses that scarce resource to its maximum. The product is improved in its quality. You can check for infection. You can process it, package it, store it, distribute it, maintain it, track it, and it becomes more cost efficient and scalable. We're starting to do the same thing for transplantation. We've created the first organ repair center in the world. OR number 18 at Toronto General is an organ repair center where we repair lungs. Our liver transplant team, with our help, is now starting to do it in livers and kidneys, and people around the world are working on this concept of saying, can we take an injured organ and make it better to transplant it? We've now opened in Silver Spring, Maryland, and are opening and partnering with the Mayo Clinic in Jacksonville, Florida, and Phoenix, Arizona, to make lung repair centers to cover the whole continent. And if you think about the potential now, we can use technology and pharmacology that we already have to diagnose what's wrong with the organ, treat it with drugs, treat it with gene therapy, treat it with stem cell therapy, make a lung that is prepared for the task, make a lung that looks like you so that your body won't reject it. These are advanced biotherapeutics have all become possible so that we can actually restore organs and build organs that are you, that have a better chance of lasting for forever. Our goal is to make organs that will outlive the recipient that we put them in. Thank you very much.